Okay. Hi, all. Uh, Very good evening to all. I'm Dr. Ashwin Mugundan, Chief Consultant in Dr. Mohan's Diabetes Specialty Center, Calicut branch. And today we are going to talk about does fast food cause diabetes? I believe we are what we eat. This has been quoted several times earlier also in terms of all the other things we discussed. But this is quite true in case of diabetes too. I have n number of examples where the diet has changed a person's life entirely. Changing a diet meant everything for them, and it has ended in a positive note. And sometimes, if the diet change is not on the better side of it, it has ended in a negative note too. Before talking about fast foods, shawarmas and grilled chicken, so and so, I would like to quote a real life example how diet changed a person's life. A patient who came to me, he's a long time patient of diabetes. Around, see, he's 25, 30 years diabetic. His creatine were always little bit on the higher side, say around 1.6, 1.7, which he was maintaining over years, maybe 5, 10 years. It was maintaining like that. Sorry, his blood sugars were also under control. So what happened in between? He went abroad. He went to UAE, Dubai, or somewhere. He went for a 6 months visit plus a leisure trip kind of thing. He forgot his tablets. Again, what happened was that he did not control his diet there. He came back with quite uncontrolled blood sugars, and his creatine started shooting up, which was quite stable for the past 5, 10 years. His creatine went past 2, his creatine went past 2.5. Then again, I was telling him regarding controlling his diet. He was eating beef, mutton, and all those things. He said, he says, Sir, this is all what is available at my home every single day of my life. I cannot avoid it. Maybe I'll try to reduce the amount, but it's not possible for me to avoid rice altogether, also and so. But next time when he came again, sugars were shooting little bit, kind of getting under control, but not quite under control. Creatine went up to 2.8. Then I told him, see, this is the right time to change your diet. It's either your kidneys or your your diet, something you have to choose from. Then he went with a determination. He went, actually, somehow he went in the center, went in some place where he has to stay, and the diet is changed entirely. Only boiled food is given, no fried items, no fast food, no red meat, nothing. Even the salt was very few used. The salt content in the food were also very less. I got a call from him maybe 20, 30 days later, a month later, telling that, sir, my blood sugars have come down, my creatinine has come down, and he's feeling so energetic. He just added a sentence at the end of the call saying that, sir, I have changed my diet entirely. I'm following this good natural diet where we are not eating anything fried, all those things which I have mentioned already. Saying that, sir, I have learned one thing in the last 1 month. Actually, our creatine, all the complications, whatever diseases we have, is simply because of our diet. Once I changed my diet, my diseases went away, my energy levels came back, my creatine went down, my sugars went down, my blood pressures went down. Everything is normal now, normal, or at least on the normal side. So that's how important your diet is in any disease you have, any problems you have, or even if you don't have any issues right now, even if you're not a diabetic, not a hypertensive, not a hypothyroid patient, not an obese person, still your diet is important to avoid any future complications, because I strongly believe we are what we eat. Regarding fast foods, yes, talking about fast food is important these days because fast food chains are quite common. Before, it was westerners headache, say around 90s and 2000s, it was a westerners headache, because in America or US, UK and all, the culture where was like drinking coke, having hamburgers, sandwiches, pizzas, all those things were quite common up there. And the disease rate, lifestyle disease rates also went up like in crazy, like anything. So the government decided to step up. They have lot of awareness programs. They have lot of alternatives. They have changed the breads they use. They are using the multigrain breads rather than using the refined wheat flour there, or the maida there. Everything has changed there, and they are coming into a balance these days. But that change which happened in the western population in the 90s or 2000s is happening right now in our population in India. We are now quite often eating out rather than eating inside our home. We are not eating home cooked food. We are eating always restaurant cooked restaurant. We are eating outside. We are eating fast foods quite more often. And many a times we think that whatever we are ordering and eating or eating outside is quite healthy, but on the contrary, it's actually unhealthy, or it's not good for your health. So, starting on that note, I would like to say certain things. Actually, fast food in the sense, there was a recent incident in Kerala where we have one of our like one we lost one life actually who ate shawarma. Shawarma is actually one of the Arabian dishes which is quite popular in South India these days, especially in the states of Kerala and Tamil Nadu or Chennai and all, I would say. And like grilled chicken is also a quite a common dish. Those who eat non-vegetarian stuffs, they think that the grilled chicken and the shawarmas are quite healthy because actually it looks like it's kind of it's not like used oil is not used at all in preparing these dishes. Still people somehow think that since oil is not there, it's not fried chicken, it must be healthy and people consume it more often. But the sad fact is that first of all, many a times it's undercooked, so the chances of an infection by eating these undercooked meat or a stale meat, because many a times we get stale meat, lot of old meats, meat carriages or meat storage things were seized in Calicut recently, because the taste gets entirely altered and you won't get to know in these food objects that whether the meat is fresh or not. So we get infections first of all. That's one part of it if you eat undercooked one. Then again, a lot of other things are used while eating this. You use kubus or the maida based roti, which is quite unhealthy, which we use along with the shawarmas and grilled chicken. And one more thing, the mayonnaise used along with it to fill the shawarmas, or the French fries to fill the shawarmas, or the mayonnaise used we used to dip our grilled chicken in is quite unhealthy. Many a times, raw eggs are used to prepare mayonnaise, even though eggless mayonnaise are there, but the raw eggs used in that mayonnaise can be a source of several type of infections, including salmonella, shigella, so and so. So that's one unhealthy part of it. But again, regarding diabetes and all those food items, it's quite unhealthy again. The calorie content in this foods actually you cannot even ever imagine. One half grilled chicken along with mayonnaise and the kubus will give you a total amount of calories you have to take in a day as a diabetic patient. So even though it's not a fried chicken, all these fast food items are causing you eat extra calories, have unhealthy food, and later end up in cardiovascular diseases and complications of diabetes. So okay, we've started getting comments in the comment section. Shalini has asked what food can be taken when we are on holidays for diabetics, since we don't get the same food that we eat at home. And yes, that's a great question. Yes, you can have you have multiple options. Better you choose from good restaurants which are healthy, which cook fresh foods rather than which is cooked and kept. Morning breakfast you can choose for dosas and idlis along with sambar rather than with chutney, because sambar will have good quite number of vegetables and the paripu and all, which will increase the protein content, and the fiber content will be increased by the vegetables in the sambar. So that's one option. You can have wheat dosas, you can have wheat upmas. Actually, there is some kind of broken wheat you get, you can make upmas with it. You can have rava upma with vegetables someday. So these are all the breakfast options. During lunch you can have either roti with sabji or roti with vegetable gravies. You can have fish gravies with along with fish or boiled eggs. Better to consume boiled egg, and if you can discard the yellow or egg yolk part, it's well and good. And then you can have chicken once in a while. Red meat is bad if you're a non-vegetarian. If you're a vegetarian, you can opt for paneer, tofu, so and so. So increase the number of vegetables or vegetable dishes in your lunch. If you're having rice, reduce the amount of rice. Increase the vegetable portion or vegetable part of it. Choose from different color vegetables. Choose different kinds of vegetable dishes like gravies. Then you can choose from you can choose salads to eat along with it, and all. And mid-meal snacks, even if you're traveling, you can have apples in between by 11 o'clock or evening. You can have some cashews or almonds which are not fried. And at night time, better opt for two rotis, and along with you can have some kurma or curry or sabji, whatever you can have. So this is the common diet diabetes people living with diabetes follow well they are travel. Now, second question from Shalini Anchan. Yes, how fast food intake can be reduced? What other food can be taken from restaurant menu? Yes, again, I have noticed this recent trend where restaurants or the pizza chains, even they say that there is something healthy pizza. And one more interesting thing I have noticed: sugar-free biscuits. People tend to get fooled with these sugar-free biscuits because many a times if you have to watchfully read the contents of the food you are eating, then then see whether it's good for diabetes patients or not. See what is not good for you. I will tell: anything that is purely based on rice is not good. Anything that is purely based on maida or refined wheat flour is not good. Tapioca is not good for you, and certain fruits in large amounts you can avoid, like watermelon may not be good in large amounts. Dates may not be good in large amounts, and mangoes may not be good in large amounts. Bananas, you can reduce the amount you can take. All these fruits may not be like better for you in larger amounts. You can cut short the amount you're taking in and among these fruits. That's one thing. And regarding the fast food portion, there is nothing good in fast food to choose from to say it's healthy or unhealthy. Better to avoid fast food altogether. No soft beverages at all like Pepsi, Coke and all. Better not to consume, even if it's zero sugar. We have lot of other chemicals which are harmful for you and your internal organs, even if it's zero sugar. Again, zero sugar free biscuits is entirely made of maida. You can see the content. I just checked. It was written ingredients refined wheat flour. It's tactfully written. That's basically maida only. So yes, you can choose from the healthy options as I've mentioned already. Answered your first question. Now Prakash G has asked: is fat and protein better than carb foods? No, nothing is better than the other thing, because purely protein-based diet, which is LCHF diet or keto diet, which is quite common, is also not good. You have to have the right proportion of all the three, because you need fats, you need proteins, you need carbs in your diet also. You have to choose simply from good carbs, because even in the oats you eat, there are carbohydrate, there are fiber content also. You need fiber also. You need all four contents. You need good amount of fiber, you need good amount of protein. Cut down on your fat to 5 percentage of your whole diet, and cut down on your carb around 25 to 30 percentage or 30 to 40 percentage if possible, and take all the right proportions of all the foods. Don't only entirely depend on only protein and fats. Reduce the amount of carbs, increase the amount of fibers, and that will be a balanced diet. Prakashi again asked, is it true that fat has lesser calories and hence better than carb foods like in some diet plans like caveman diet? I totally do not agree with that comment. Fat diets are actually fat diets. You cannot keep on eating fats, because it has other side effects on your heart, kidney, and all your liver and all your internal organs. Not only that, the calorie content is also on the higher side if you fry your food in any form. So fat is not a good ingredient in your food, but you need good fats, polyunsaturated fats in your diet. Be wise in choosing your cooking oil, and all. Never have fried food, always have boiled food. And that's my opinion. Kameshwari Venkata Vildi: can diabetics eat sugar free sweets and ice creams? uh, Yes, once in a while, if your blood sugars are quite under control, if you're dieting, if your diet is good, if you're taking your medicines properly, you're exercising good, yes, you can have sugar-free sweets and ice creams once in a while when you feel like having. Shalini again asked, nowadays we get diabetic rice. How different is it from regular rice? Does it work to reduce blood sugar? Absolutely, yes. We have Dr. Mohan's rice, which is engineered actually. It's high fiber. We have high fiber rice and brown rice. Basically, rice is considered good or bad according to the glycemic index of that rice. Glycemic index of a normal white rice is 100, which means if you take that much portion of that rice, your blood sugars will almost increase by 100. So low glycemic index rice is always better for a person with diabetes, such as brown rice of Dr. Mohan's, high fiber rice of Dr. Mohan's. You have such kinds of rice which have low glycemic index. You can search for low glycemic food index foods and rice items. Damodaran has asked, is junk food cause appendicitis or is appendicitis cause diabetes? Yes, junk foods can cause appendicitis because any unhealthy diet can cause inflammation of appendix, which is basically appendicitis. Appendicitis usually doesn't cause diabetes. Diabetes is an entirely different entity. Diabetes is related to the pancreas, which is an internal organ which secretes different kind of hormones. Shalini has again asked, can millets be taken daily? If yes, how much can be taken daily? Yes, definitely millets are good for your diabetes. Even if you can include millets in your breakfast, lunch, and dinner, you can include all your meals. Only millet-based diet uh, for lunch, breakfast, and dinner will help you reduce your blood sugars too. Kameshwari has again asked, how do we calculate average blood sugar if HbA1c is 6.5? See, you did not calculate average blood sugar because HbA1c is a measure of your average blood sugar, and 6.5 is a good control diabetes actually, because above 7 is uncontrolled diabetes, between 6 and 7 is controlled diabetes, and it again depends on your age and your other organ damages as well. If you're a heart patient, if you're very quite elderly, like 80, 82 years of age, your HbA1c can be between 7 and 8. But if you're young, say around 40 to 60 years of age, you don't have any other comorbidities, you should have an HbA1c between 6 and 7. That will hardly correspond to, that is actually extrapolated. HbA1c 6.5 or HbA1c value is the actual measure of your average blood glucose. 6.5 will hardly correspond to 140, 130 to 150 range. Will this average be throughout the day? No, actually, that is not throughout the day. To look at throughout the day blood sugar pattern, there is something has come up in recent times to measure the glycemic variability, the 24-hour profile of your blood glucose, whether it is increasing just after your meal, whether it is coming down just before your lunch. All these things cannot be assessed by only an HbA1c. We need a continuous glucose monitoring device called AGP, or ambulatory glucose profile, has to be done for you to actually accurately assess whether your blood sugars are going in a normal range throughout your day, 24 hours into 7, and throughout a year. SDH has asked, sir, my HbA1c is 6.7, glucobam 25 with breakfast, diabetes, which I'm getting weakness. Why, sir? Yes, HbA1c 6.7 is quite good control, and you're taking only mild medicines which should not cause low blood sugars. But ideally, you should get an AGP done or a continuous CGM device attached and see whether you are getting low sugars in between, or your blood pressure is under control, whether you have any other illness which is causing your weakness or any other problem which is causing your weakness. You should check your thyroid levels, you should check your liver function as well. Ideally, better go and meet a doctor if possible, get a consultation done and see actually what is causing your weakness rather than jumping into conclusions right away. Giri Raja is asking, when sugar level exceed 200, I feel back, neck pain, and slight giddiness. What is the reason? Kindly explain. Sometimes I feel unhealthy. Yes, there are certain body types which detects the changes in blood sugars or catches the changes in blood sugars quite easily. Like even a slight increase above 200, they will feel all those changes in their body, and that's how maybe your body type is. That's quite normal. You don't have to worry about it. Only good thing is that your body acts like a machine for you. You don't have to do a glucometer reading every time, maybe, but better you should keep it below 200 somehow all the time, and that will keep you healthy, and you will not feel unhealthy at all if your blood sugars are below 200 all the time, or better keep it below 180 if possible since you are young. Shalini has again asked, can diabetes consume the store-bought health mix powder? Nowadays, health mix powder are marketed a lot for its benefits. Health mix powders, I never endorse. I don't endorse any protein supplements or protein powders either. I believe, strongly believe, home cooked food in the right way give you all the mixture of all the necessary vitamins, minerals, and all the fats, proteins, fibers, or whatever you need in your body. That's actually that is a healthy diet pattern rather than taking all the supplements unnecessarily. I never endorse such products. That's only my personal opinion. You can always ask your doctor regarding that, because every doctor might have a slightly different opinion on such products. Why is increase in blood sugar after taking food? uh, because your body is not actually processing the blood sugars the way it is supposed to process. There is a hormone inside your body. Damodaran sir has asked. There's a hormone inside your body, insulin, and so many other hormones as well, glucagon and so, which regulates the blood sugars in your body when you eat something or even when you don't eat something. Your liver is also working on it. Liver, pancreas, kidney, all the organs are working on it to regulate your blood sugars in the normal level. So when this regulation, or when there is a loss in the rhythm among all these processes, your blood sugars will shoot up, because either of these hormones are not working properly, or whether it has a resistance to its action. So your blood sugar is increasing after your food. That's why you have diabetes, which is not normal. So Kameshwari has again asked, how do we reduce microalbumin level by food? Maybe you can cut down on heavy protein meal. Say you can avoid red meat, you can avoid sprouts. If you have a heavy microalbuminuria, that is one way you can reduce salt to a least level, because several studies have shown that uh, salt intake in India, or an average Indian diet, is about 12 grams a day, where it is supposed to be only 2 to 3 grams per day. So you have to cut down your salt in all your gravies, curries, dishes altogether, one fifth or one sixth of what you're taking already. So that's one way to reduce the microalbumin. You can reduce your blood pressure also. Good exercise and good diet can also reduce microalbumin level. When all the parameters are under control, how to reduce fatigue? Yes, fatigue is an important aspect to be addressed these days. Maybe you should check for vitamins and mineral deficiency, especially vitamin, whether you are vitamin D deficient or not, whether you have good levels of vitamin B, whether you have good levels of hemoglobin in your body, whether your blood levels are good or not, or whether you have any associated disorders or associated things such as cholesterol levels are high, liver function, you have fatty liver or not, your thyroid levels are normal or not. All these things you can check. Even when all these things are fine, all your vitamins, all these things are replaced, supplemented, and still you experience fatigue, maybe you should check your glycemic variability to put an AGP and see whether your 24 hours profile there are too many fluctuations happening inside your body which is causing fatigue to you. So that's it. Thank you again, Kameshwari, for repeatedly asking really good questions. So now talking about again, fast food and diabetes. Fast food causing diabetes? Yes, fast food can definitely cause diabetes if taken for long, because there is this culture developing in Indian subcontinent. At a very young age, the children start eating fast food. They cannot, once they get the taste of it, they cannot go to a different food or alternative food or a home cooked food at all. They don't. Finally, the parents end up like giving them. They have no other option. The kid is not eating anything else. Kid wants either white sauce pasta, burger, pizza, fried chicken, soft drinks. All these things the kid is asking, and the kid is, rather than parent thinks that rather than making the kid starve, I would give all this fast food to my kids. Finally, the it's actually he or she is doing a harm to their kid. The kid will end up with diabetes at a later stage of their life. Even if they don't get obese, all these things will adversely affect their internal organs, including your kidneys and pancreas too. Prakash ji has again asked, any simple method to identify whether my high blood sugar is due to insulin resistance or lack of insulin action. Uh, Okay, high blood sugar. Fine, fine. Yes, we can always test for your C peptide levels, which will correspond to your insulin action in your body, or insulin secretion in your body, which is actually corresponding to the insulin secretion. And if that is good, you have fairly good amount or an excellent amount of C peptide in your body, then your high blood sugar is mainly due to insulin resistance or lack of insulin action. Second thing, we look at an external markers of insulin resistance in your body, which is acanthosis nigricans, skin tags, and all those external markers. We start noticing the moment you enter our clinic, inside our clinic, whether you have external signs of insulin resistance or not. That simply by looking at a patient, we can assess whether he or she has insulin resistance. By assessing all these factors, looking at your medications, looking at your blood sugar levels, we can definitely tell whether you have predominant insulin resistance, insulin loss of insulin secretion, or a resistance to your action of your bodily secretion of insulin. Fatty Mani Marcos has asked, fatty liver cause diabetes? Usually, fatty liver as such cannot cause diabetes, but these two are closely interrelated. First of all, there are no such, not much of mechanism for the body to store glucose inside your body. Many a times it turns it to a fat and store it inside liver, blood vessels, so and so. So many a times uncontrolled blood sugar patients, or a type 2 diabetes patients, or any diabetes patients will have a fatty liver, underlying fatty liver, and until unless you check it, you may not get to know also. All the symptoms may not come in the early stage, and this has a actually this has an importance in control of diabetes also. If you have uncontrolled, if you have a fatty liver disease, if your enzymes such as SGOT and SGPT are raised, just by controlling it, your blood sugars will be more controlled, because when the liver is inflamed, the diabetes control may not be as good as we want it to be, because the fasting blood glucose is being maintained by the liver also, not only your pancreas but also your liver also. So your liver need to be in a perfect working condition for your diabetes to be under control. So Prakash ji has asked, so that my medication not much focused only on metformin versus insulin inducing medicines. Yes, exactly. Because there are around 10 to 12 kind of tablets we can give these days, which have different kind of mechanism of action. That's why in Dr. Mohan's, we always check your blood glucose levels, we check your fatty liver, we check your insulin production, we check your insulin resistance, all these things. And then we decide your treatment, which is the best combination of medicines for you to control your diabetes. So again, does every diabetic need to check C-peptide and when to get tested? Yes, ideally, Kameshwari ma'am. Ideally, every diabetes patient need to get their C-peptide checked. At least first, when they are first diagnosed with diabetes, they should get their C-peptide checked. And if it's nil, if they are type 1 diabetic, there is no point in repeating after that. If they are type 2 diabetes, if they have some sort of C-peptide production, we can always repeat at a later stage, maybe too yearly or yearly, to see whether your C peptides have improved or not. There are certain medicines which can improve your insulin production or C peptide levels at a later stage on the long term basis, and there are certain studies which have proved that. Mani Marcos, I'm a diabetic taking medicines, sugar level under control, but evening feel tired, feel pain on legs. Evening feeling tired, fatigue is again, maybe post lunch you should check your blood sugars to see whether it's rising sharply from say around 100 to 230. That sharp rise will cause a tiredness or fatigue in the evening, or you have to check whether evening your blood sugars are coming down too low. Better to get an AGP done to see your fluctuations, wide fluctuations of your blood sugar. That may be one cause. Second cause may be your vitamin, you are vitamin deficient, or mineral deficient, you should add more vegetables, more colored vegetables in your diet, more fiber containing food in your diet to increase, to gain your, to reduce your fatigue. And the glycemic load of your food should be on the lower side as a whole when you consider it as a meal. That will also help reduce your fatigue too. Kameshwari has again asked, when should diabetes go for CGMs, and can one fix it on our own? Again, just like C-peptide, every diabetes patient should get their CGMs done at least once in their life, and whenever once in a year, following by which once in a year at least, to see that the glycemic variability is taken care of. And whenever the sugar goes under control, whenever they feel there are a lot of wide fluctuations in their blood sugar, they should get their CGMs or continuous glucose monitoring devices fixed. How to overcome leg cramps at night? Yes, again, feeling pain on legs, asked by Mani Marcos. Kameshwari ma'am has asked the same thing. Leg cramps at night is a sign. It can be an early sign of increase in your blood sugars, or secondly, it can be an early sign of diabetic neuropathy as well. Leg cramps, when there is a fans, uh, the wind is coming, when AC is switched on many a times. Most of our patients, diabetes patients, when they are uncontrolled, or a long-term diabetes patient, might feel cramps in their legs at night. That may be an early indicator of neuropathy. Get yourself checked by a proper doctor, or a diabetologist, to see whether there is an early neuropathy change, whether you need to treat it with specific tablets for neuropathy, or certain some simple other methods to treat neuropathy will be enough for you or not. That all depends on the severity of neuropathy you have, or whether it's actually neuropathy or not. We have to assess you personally for that. Then Damodar NK, my fasting blood sugar 92, pp is 223. Any danger appendicitis operation? Since your fasting blood sugars are sitting well under control, I believe that your postprandial is high, because maybe you're taking rice based diet of patiri putta or something. Fasting blood sugars are major sole criteria for any major surgeries, because if your fasting is fine, they can easily control your blood sugars during the surgery by simply giving whatever medications is, like insulin and all. Post surgery also, it's quite easy to control. There are not much of any danger to get an appendicitis operation done, surgery done, because usually acute appendicitis is an emergency surgery. You cannot wait for long enough to for your appendicitis to burst or anything. If it's actually indicated, yes, fasting 92, you can get your surgery done without any danger at all. Yes, we are half an hour into our talk. I hope there are more questions coming up from Facebook and YouTube. Meanwhile, I would love to go back to my previous topic. Uh, we have a lot of patients. Like, I still remember this young girl, 32-year-old female, who came to us with diabetes, type 2 diabetes, which is quite uncommon at that age. She used to have a lot of fast foods and all in her diet, and her blood sugars shooted up like anything. She had family history of diabetes. By simply lifestyle modification, I asked her to stop her fast food entirely, completely. No more burgers, no more soft food, soft drinks, nothing. Go for a healthy diet, go for a walk regularly for 30 45 minutes. We had to start her on tablets because she came with blood sugars of 300, 400, and all. But interestingly, after a healthy change in her lifestyle, within 1.5 months, we were able to stop her medicines completely. Her diabetes reversed entirely. She lost good amount of weight. For the past 1.5 to 2 years, she's on not on any medications at all, and she's still continuing her good healthy lifestyle now also. More questions have come. Srinivasan Ramanujam, I have started insulin 2 months back. There is an increase in body weight. Is it okay? I have diabetic for the past 30 years. Yes, insulin is given when there are uncontrolled blood sugars, or when it is indicated, or when your blood sugars are not controlled even with 2 or 3 medications at all, or if there are any surgeries, or if there are any acute infections and all, insulin is given. Because again, insulin is one of the strongest medicines we can use to control your blood sugars. It's one of the best medicines so far. We have 100 years of experience in using insulin because it was discovered in way back in 1922. Yes, insulin is an anabolic hormone. Having said that, insulin can increase your weight a little bit. Again, when you have uncontrolled blood sugars, there is a loss of weight happening in your body. Your good proteins are used up and you will have loss of weight. When these blood sugars come under control with the use of insulin, that also will cause a certain amount of gain in weight in your body. So both this combined will can increase your weight possibly. uh, yes. Ilaha has asked, is the functional and complete cure of type 1 diabetes on the horizon? I mean, stem cell combined therapy with gene editing technology. Yes. In the recently concluded conference in Barcelona in Spain, most highlighted topic was the cure or how to prevent type 1 diabetes at an early stage. That is stage 3, usually when the patient is coming to us, because we cannot do a population screening for a type 1 diabetes. Type 2 diabetes is quite common. Population screening is actually useful because 50% of the type 2 diabetics goes undetected or undiagnosed at all. They are not even aware they have diabetes. But in case of type 1 diabetes, population screening is not easy. It's not a familial disease. You cannot predict accurately when it will come or not. But at least if you catch it at stage 2 or stage 3, there are multiple therapies coming up which can reduce or halt its progression at least, or sometimes maybe reverse it also. But everything is in pipeline. We cannot nothing has proven yet, nothing has approval yet, complete approval yet as of now when I'm talking to you. But everything is pipeline, and a lot of new things are coming up in the world of treatment in type 1 diabetes too, not only for type 2 diabetes. You can expect something in the near future, I can assure you that. SDH vitamin deficiency is caused to diabetes in youth people. Youth, please tell. I think you're talking about vitamin D. Maybe yes. It's not due to diabetes as such. Many among our population, when screened, are found to have are found to have vitamin D deficient even if you don't have diabetes, because we don't have adequate exposure of sunlight as we are supposed to get. And the best time to get adequate vitamin D through sunlight is to go to sun at a time when we cannot usually go, that is between 11 a.m. to 2 p.m., which is very hot. And to get exposed to sunlight at that time till our skin color changes a bit, that means you have got adequate UVB exposure, and vitamin D will be produced from your skin with that much exposure of sunlight, which we don't usually get. So that is quite common these days. And even in youth also, it's not entirely related to diabetes only. Even people without diabetes have vitamin deficiencies too. Yes, that comes, I think, questions. No more new questions have come up. So I was talking about a patient or a young girl who reversed her diabetes by stopping fast food entirely. Because again and again, I'm telling you, we are what we eat. If you're eating an unhealthy fast food diet at least once or twice in a week, also, that is going to affect your organs like anything. People tend to ask me, Doctor, the medicines you are prescribing, are they going to affect my kidneys? I say entirely, I said just, I tell them no, it's not going to affect your kidneys. If your diabetes is under control, your kidneys are never going to go bad. But having said that, the diet you are eating can affect your kidneys. The high salt diet, the fast foods you eat, the fried items you eat can affect your internal organs, including your kidneys, heart, and liver very badly, and you might end up with complications. So change your diet rather than stopping your medicines or getting go to a quack and getting not good treatment, and again your blood sugars going uncontrolled in between. And only when the blood sugars go very high range, or your body tells you that your blood sugars are going high, you're getting tired and all, you come back to us. That's not a healthy pattern. Once you're diagnosed with type 2 diabetes or any diabetes, the moment of that moment onwards, if you keep your blood sugars under good control, I can assure you, I can guarantee you that you won't have any complications your entire life. Yeah. So, Ilaha, thank you, doctor. I really appreciate you for your precious information on diabetes treatment. Thanks a lot for patient listening. I think it's 40 minutes now. We have been talking. I will slowly log out because I'm also low on my energy levels. I had to cross heavy traffic, drive, and come. Just got back home. I couldn't eat or drink water, or even I just sat back in front of my laptop. So yes, to conclude my today's talk, I would like to thank all of you who has asked your genuine doubts in this in Facebook and YouTube platforms, for actively participating in this discussion or the talk, and concern you're raising your concerns. I'm really happy to answer your concerns too. Thanks a lot for patiently listening to me for the past 40 minutes. I would answer this last question: which are best food for diabetes patients? Yes, you can have pulses. You can include more vegetables in your diet. You can have cashews and almonds in a limited quantity. You can have milk and milk products. You can have fish which is boiled or cooked, not fried one. You can have boiled egg one a day, not egg yolk, not more than one a day. You can have chicken once in a while. You can have certain fruits which are good for your diabetes, that is apple, orange, musambi, guava, pomegranate, and not too ripe papaya. So these are all the foods which are generally good for your diabetes. So with that, I would like to sign off. And again, good night to all. It's heavily raining in Kerala right now. I don't know how it is there at your place. Have a safe night. Have a safe life. Have a healthy life. Lead a good lifestyle. Lead good. Have good diet in your day-to-day lives. Eat good diet. Exercise regularly. Keep your health at check, because it might save you more than 10 to 15 lakhs of money in next 10 to 15 years, just by simply changing your lifestyle. Not your medicines, not your doctor. Just by simply changing your lifestyle, you can save a lot. So that's one aspect of it. And again, yes, fast food causes diabetes. Better to avoid fast food entire in your entire life. Thank you. Thanks a lot for patient listening. I would like to sign off now. Again, good night all. Bye.